Hi. Thank you so much for supporting me. This is something that without your support, I cannot do it as a human being. Now, today I want to talk about something very cheap. You'll always get it in your exams, in the wards, and everywhere. This is an APH or antepartum hemorrhage, just by definition. Very, very cheap. Don't forget the keys, the marking points. Don't forget. Yeah. Now, somebody asks you what is an APH. APH simply refers to bleeding from the vaginal tract during pregnancy, yeah, after 28 weeks, but before delivery. That is the definition. So simple, yeah. What are the causes? Placenta previa, placenta abruption. But today I want to talk about placenta previa. Now, placenta previa simply refers to implantation of the placenta near or at the cervix. That is the definition, simple. Signs and symptoms. The blood is bright red. It could be scanty or heavy. There's painless bleeding, yeah? There's low blood pressure depending on the loss of blood. The fetal heart rates are hard if you use a fetal scope. Soft, relaxed uterus. Non-tender abdomen. Simple. There is paleness, conjunctival pallor, don't forget, because this person losing a lot of blood. Yeah, those are the signs and symptoms basically. The one that I'm a bit forgetting, you can add for yourself. But once you've talked of the fetal parts, they're palpable. Yeah, you can hear the fetal heart rates. Those are enough. Now, let's talk about grading. How do you grade? We have grade 1 up to 4. Now, grade 1, this simply refers to is where the placenta is situated at the upper uterine segments. You get that? While its lower margins, they dip themselves into the lower uterine segment. Simple. Type 2, this is where the placenta is partially situated at the lower uterine segment, while its lower margins eh, dips or goes to the edge close to internal os, but not covering it at all. Grade 3, this is where the placenta, are you getting? This is where the placenta partially covers the close internal os, 3 to 4 centimeter dilatation. That is simple. Grade 4, this is where the placenta is centrally placed at the internal os when fully dilated. Now, we have differential diagnosis of placenta previa. Labor in a show that is bloody. That is, we have cervicitis, we have carcinoma, we have trauma, we have cervical polyps. Yeah, all those, you can name them. Look for the rest. Now, in your diagnosis, basically, you'll have to do investigations. Now, investigations that you'll do a sonography. Sonography will help you identify whether the placenta is posteriorly placed or anteriorly placed. You'll do full hemogram. Basically, you'll check the HB level. This a mother that is losing a lot of blood. You may lose the mother. You'll do grouping and cross match. You'll want to transfuse this patient. Yeah. So those are some of the tests that you'll do. Now, in your management, you'll consider this when in type 2 and 3, where the placenta is anteriorly placed, just rupture the membranes and deliver. If the time are not reached, you can still induce. Now, that one will depend with the gestational age. You'd still buy more time up to 34 weeks, then you deliver and take the baby to the NBU. That is after giving dexamethasone to mature the lungs. Now, in a placenta previa, where the placenta is posteriorly placed, in you don't attempt, you take to theater. Basically, that's the management. Yeah, don't forget to give IV fluids because this somebody may go into shock. Now, quickly on complications. This is somebody that is likely to go into maternal shock. There is fetal hypoxia. There is postpartum hemorrhage. This is somebody that may develop disseminated intravascular coagulopathy. This is somebody that may develop uh, air embolism. You can look for the rest complications. Yeah. Thank you for supporting me. Subscribe now and let's learn together. Thank you for watching. May God bless you.